The human liver is an amazing organ. It performs some pretty vital functions, like regulating blood sugar and processing nutrients, storing the nutrients you eat and releasing them into your bloodstream as your body needs them. But did you also know that your liver does detoxification? It converts harmful substances like alcohol and other everyday foods into harmless products that can be excreted. Now that doesn't sound like an organ you can risk damaging, right? But the truth is, the liver is often attacked by a virus known as hepatitis. And on today's HealthWise, we find out more about this virus, all 5 types, and tell you what you can do to stay hepatitis free. Hepatitis poses a serious threat to the liver. Upon entering the body, the virus attacks the liver, causing varying stages of infection and diseases. These range from mild to chronic and put victims at high risk of cirrhosis of the liver as well as liver cancer. Hepatitis also leads to death in many cases. The World Health Organization (WHO) reports that viral hepatitis kills 1.5 million people worldwide every year. Alarming statistics that have prompted the WHO to push for a change in attitude to the various types of hepatitis. The WHO has designated July 28 as World Hepatitis Day to raise awareness and to call for access to treatment and better prevention programs that start with knowledge of how the virus enters the body in the first place. This depends on the type of virus, whether it's hepatitis A, B, C, D, or E. Hepatitis A and E are caused from ingesting food or water contaminated by feces of an infected person. It usually occurs where there's a lack of safe water and in cases of poor sanitation and proper hygiene. Certain sexual practices can also contribute to the spread of hepatitis A. While the A virus is not known to cause chronic liver disease, it does cause debilitating symptoms and acute liver failure, which can be fatal. Hepatitis B is contracted through exposure to infected blood, semen, and other bodily fluids. It can also be transmitted from infected mothers to infants in childbirth, transfusion of unscreened blood, and through contaminated needles from drug use or medical procedures. The B virus also poses a risk to healthcare workers who get stuck accidentally by needles while caring for infected patients. Hepatitis C is passed on mainly through contaminated blood. Transmission through sex and from mother to child is also possible, but much less common. Hepatitis D infections occur only in those who are infected with the B virus. This dual infection of the B and D viruses can lead to a more serious disease and worse outcomes. Some of the symptoms of hepatitis include loss of appetite, an enlarged liver, tenderness of the liver, abdominal pain and tenderness, nausea, vomiting, and fever. Other symptoms include fatigue, joint pain, and jaundice, which is displayed through yellowing of the skin and eyes, dark urine, and pale stool. The good news is, hepatitis viruses can be prevented by making informed lifestyle choices. Improved sanitation along with proper hygiene practices are effective ways to prevent the diseases caused by the hepatitis A and E viruses. In places where sanitation is inadequate, water should be boiled, all food properly cooked, and fruits washed, then peeled. In addition, there is a hepatitis A vaccine. Protecting yourself from hepatitis B can be done by avoiding contact with infected blood or bodily fluids. This means avoiding unprotected sex, sharing razors, nail files, toothbrushes, or needles used by infected persons. There's also a vaccine for the hepatitis B virus. Doctors recommend it for all infants as soon as possible after birth, followed by 2 or 3 doses to complete the primary series. However, children and adolescents under 18 who haven't yet been vaccinated can still get the vaccine. The hepatitis B vaccine also provides protection from the D virus. As for hepatitis C, there's currently no vaccine, but research is ongoing. Persons such as healthcare workers or caregivers who treat patients with contagious forms of hepatitis should wash their hands, utensils, bedding, and clothing with soap and hot water. Also, people traveling to countries where hepatitis is widespread are advised to get vaccinated before leaving. Hepatitis can pose a serious threat to your liver, but there are other factors that can contribute to liver damage. Among them, excessive drinking of alcohol, traumatic injury like the kind you could sustain in a car crash, autoimmune disorders, and adverse reactions to medication. Be on the alert, practice proper hygiene, and check with your doctor. Be good to your liver and it will be good to you.